basically you have to know from your primary care doctor, what are your goals? What should be your hemoglobin A1C? What should be your fasting blood sugar? What should be your blood pressure reading? What should be your serum creatinine? What is your GFR? What is your microalbumin? What is your cholesterol? It's a very important thing. Even with mild kidney disease, you have a very high risk of heart disease.
Okay.
Kidney patients don't die because on dialysis. They die from heart condition.
Hi Rashmi, how are you?
Oh, I'm good. It's a great
Long
day.
time no see.
Almost near holidays,
Yes.
Christmas time.
Yeah, it is. Yeah. So, I've always been impressed by you, Rashmi, about you and your professionalism, and you work so hard and always taking care of your patients. I just wanted to know about what exact medical field it is that you work in.
So I am a kidney specialist, and its literal name is called nephrology. But the kidneys, in order to become a kidney specialist, you have to do internal medicine. So basically, even though I'm a specialist in nephrology, a lot of it also covers different aspect of medicine.
Okay.
So dialysis, kidney transplant, and most important to me is that how we can prevent from kidney disease happening and also progressing, because it's considered to be a chronic disease. I mean,
Okay.
what I mean to say, you know where the kidneys are. There are two kidneys on each side of the spinal cord, and
Okay.
they're so little, like they're called beans, kidney beans, because they're bean shaped, and the urine is nothing but filtered blood. What I mean to say, when the heart pumps the blood to the kidneys, it gets filtered inside the kidneys. There's a complex mechanism. We are not going to go into that, but the blood gets filtered, and then once the blood gets filtered through the complex mechanism, the urine is formed. So urine is basically a filtered blood.
Okay.
So we all need to eat the good stuff and the bad stuff. The good stuff is for energy. I mean, we eat food, I mean
Yeah.
to say.
To-
The good stuff is for the energy. You know, you need energy day to day. But the bad stuff, after all the waste product that comes out, like for example, if you're eating the meat, depending on the type of the meat you're eating, it will produce the junk. Some of the meat will produce more junk, some of the meat will produce the less junk. And so it's basically the kidney's job is to filter all the waste product. Different kind of food like nuts bring different kind of waste product. All kinds of different type of the products if you're eating carbohydrates. So they're all being selected and filtered by the kidneys. So kidneys are very smart. They don't let the protein go out of your blood. So protein goes back into the blood. They don't get important electrolytes that important for functioning of your heart and for your rest of your body. It all goes back. So if you look at the urine in a normal person, that tells you about how your kidney function is. It's clear. There's no protein in it, no blood in it, no infection in it. And then you'll also look at the acid level, pH level of the urine. And so a simple urine test can give you a lot of information about what's happening at the kidney filter level.
So how many years, Rashmi, have you been practicing this?
Over 25. Actually, I did get the recent plaque, 25 years.
Oh, wow. Okay, that's awesome.
Lot of
Many
years
experience.
now.
Yeah. So, when we are, we as humans, we eat and we also sometimes overeat, and we, over a period of time also we develop some issues, health issues, right? And also I feel sometimes it's genetic also. Do you think it's genetic also? Some of this kidney issues could be genetic or no?
So the number one cause for kidney disease, like 50% of the patient goes to dialysis are diabetics. You know how common is diabetes? Almost you go to any party, anywhere, I have diabetes. So diabetes is the number one cause. 30% of the patient goes into kidney failure because they have high blood pressure.
So because of, so 30% is diabetes?
No, 50%, 45 to 50%, almost half
Oh.
the patients goes into kidney problem because they have diabetes.
And why does diabetes cause it? Is there some scientific reason?
Yes, so it's the elevated blood sugar.
Okay.
The blood sugar, the high blood sugar, it damages the small blood vessels inside your body. So your whole body, you are set up with the heart and big blood vessels going all around your body.
Yeah.
But there are tiny vessels, that little tiny vessels in your eyes, supplying the blood to your kidney organs, and they're in your nerves, nerve endings. And these little blood vessels, they get diseased with elevated blood sugar. So you must have heard, control your diabetes. What does that mean? Basically, bring your blood sugar down to the level that is not damaging. And how it damaged, this glucose can go inside the cells of these little nerves, little blood vessels, and then eventually, like, there is a medical terminology, but I think they damage those little blood vessels.
Okay.
So you don't see anything, you don't feel anything, and it's a silent disease. So basically, kidney disease is silent, diabetes is silent, high blood pressure is silent, and some of the over-the-counter drugs that Aleve, like people are used to taking Aleve, they think it's a benign drug. Every time there's a headache, there's a pain, take 2 Aleve
painkiller
all the time. Like, so if it Aleve, over-the-counter medication, sometimes you're going to go to the contrast, the radiological procedure. And your question was, could it be genetic? Yes. Kidney runs in the family. I mean, there's a high risk if your family history of kidney disease, or somebody in the family is a diabetic, or somebody in the family has kidney disease, or dialysis, they will have high risk.
And you said 30% is blood pressure, like people have high blood pressure.
30% of the kidney patients goes on dialysis are high blood pressure.
Okay.
Then remaining, there's 30%, that's all categories.
Okay.
So basically when we see the 70% of it is known causes, 30% of it is unknown causes.
Unknown, okay.
The 30% of that unknown could be, that's where you may not have diabetes, or there may be something else, like your own body is producing antibodies against your own blood cells and creating the damage to your kidney cells.
Okay.
Or you're born with one kidney. When your kidneys is forming in the womb, it separates two separate parts. But then sometimes one kidney is there. Sometimes there's only a little portion of the kidney left.
Okay.
You're born with one kidney.
So that's
or you may have an accident, car accident or something. Or you may have some sickle cell, not sickle cell, something that led to the removal of the kidney, like kidney cancer.
So those are fall under the 30%, which we don't know, like, so non-preventable.
Yeah, most of the 70% of it is preventable. So that's a big percent.
It's a big percent.
The 30% of it is, you will know some of it, or you may not know, but there is a treatment for everything.
Yes.
So, but if you don't even know that you have a kidney problem, you're not going to address it. So first thing is to screen yourself.
Okay.
For kidney disease, when you go to the primary doctor, you ask them, what's my kidney functions are? And if you want me to tell now, one of the most important thing is creatinine, serum creatinine. You should ask, what's my creatinine? It's a blood test that tells you about how good or bad your kidney functions are. And the main thing is that if I think it depends on different body size. If you're a small person, your baseline will be low. Okay. If you're a high person, if you're like 6 feet tall, athletic person, a lot of muscle mass, in that case, your baseline could be 1.2. For sake of discussion, if you have creatinine, let's say 1. So if it goes from 1 to 2, you have lost 50% of your kidney function. Okay. If it goes from 2 to 3, you have lost 75%. Okay. From 3 to 4, it's almost 100%. But it's not so simple because of the different body size, because of different gender, different bodies, age. So what we do right now, that we come out with another number, it's calculated based on your creatinine, and it's called GFR. And based on the GFR, the kidney disease itself is divided into 5 different stages. Okay. Stage 1, 2, 3, 4, 5, and it's almost like a table of 15, where you have if your kidney function 100 to 90 is normal, 90 to 60 stage 2, 60 to 30 stage 3, stage and 30 to 15 is stage 4, under
And
30
then
stage
the
5, and it's like progression of kidney disease.
Okay.
So doctor, when you go to a nephrology, they treat you based on what stage you're at.
Okay.
If you're at stage 3 already, like under 60, then it's chronic kidney disease. And natural history of the kidney disease is going to progress. So you need to talk and work with your nephrology, with your primary care. What are the steps you can take to slow down the progression? Like if you're supposed to go on dialysis 2 years, you can delay it for 8 years. I have several cases like that.
That is mostly, is it diet?
There are many different things, strict control of the diabetes, and in a way that patient can handle it. You know, don't forget the patients are human beings, okay? Like if you come to me, let's say, for example, as a patient, you have your style of eating.
That's not going to change suddenly.
And your diet, like I see diversified patient population. Like if you're Chinese or if you're Italian, I'm not going to give them Indian diet, right? And like I'm Indian and I love my ice cream. I have to have ice cream every day. And if I don't get ice cream, my life is horrible. So that is what my style, I'm saying, that is what I want the patient to recognize. What is their lifestyle important to them? So I will make you do a diet history. And don't cheat. Be very honest with it. Like, I have to have ice cream. Maybe in the end you can have ice cream for the taste that you're having it. Or maybe the day you eat the ice cream, you can have that. So, but I'm not the expert on that because that's not my field. So I make you do week of diary or 2 weeks of diary, but it should be a very
honest,
open, honest, transparent diet menu suitable to your taste buds. Because any diet, I can give you 10 different pamphlets, you're going to throw them into the garbage because, oh, I don't eat meat. I'm a vegetarian. Somebody gives me a whole Chinese food diet that's full of meat. Trash it. And it won't work. So from day one, I have been doing it and it's really successful because it suits your taste buds. So I tell them that you will see this dietitian and I'll give the prescription. You take your homework that you need to do and then work with the dietitian. I haven't heard a single complaint.
Okay. So the process that you do for that you said, if there's kidney disease and if it's at stage 3 or if you're saying like it's a higher stage, then we have to intervene with the diet, and then the way you process it is they write the food diary, and then based on that
they will work with the dietitian.
They will work with the dietitian.
The prescription is mine, and then I monitor them every 3 months depending upon stage 3 every 3 months, 4 every 2 months. There are guidelines and there are standard of care, evidence-based guidelines.
Okay.
So we monitor the patient based on that. And you know what, the success of any treatment is if the patient can follow and can understand. If it's really hard on the patient, you can try. I don't really talk just for sake of talking because I want to make it work for that patient.
Yes. Yeah.
So that is one thing is like they don't understand demand versus supply, right? So I give an example to the patient and I will put it here too. Let's say if you have a factory, like if you're running a school, I can talk to you about the school. Regardless, let's say if you have a factory that has 100 people to run the factory, right? So if that factory is running on 100 people, 50 of them got sick or got flu.
Oh, wow.
So those people cannot work. So now you're making those 50 people do the job of 100 people. The factory need is still the same. The demand is still the same.
Yeah.
But you're not having enough supply.
Yes.
So what do? Then 10% more people will go. 10 people will go. 10 people will go. That's how is the concept of kidney progression. The disease progresses from 100%. You have 100, then 60 left, 40 left, 30. You're not doing anything, 10%, and then you go to the doctor because you're not feeling good. It's a disease that's silent, and then they say, oh, you need dialysis. We see patients very first time, they don't know what's wrong with them, and they need dialysis. So nobody likes dialysis, that's the truth, right? But you can avoid it, you can prevent it, or you can defer and delay it.
So let's say if someone has like no symptoms and that doesn't usually if it's 30% or 50% or whatever that percent is, there'll be some symptoms, or will be completely silent.
You could be completely silent, and that's why American Diabetic Association and American Kidney Foundation, I mean all these national kidney quality outcome, whatever guidelines, different guidelines, they suggest that you should get your urine test done at least once a year
Okay.
if it's normal, and you should be checked for microalbumin. Microalbumin is the protein that if you do the urine analysis like a simple dipstick, it won't show. So it's less than 300 milligram you're picking up. And then also you should check your blood pressure, and the blood pressure goal is not 140 anymore, 130, 80, 70. And if you have a good primary, a good nephrology, they will tell you all these things. These are all quality metrics.
Okay.
Now doctors are required to follow for your benefit. And so blood pressure should be like, it's a 150. I just give you an example. I had a friend, 170 millimeter Hg blood pressure, and I did mention that's too high, but it's actually fine. I don't need to do anything. And you know, the bad guy, I mean, we said it's done, but until he end up having a major stroke. And so it's like you don't want them to go to that stage. So I feel my role is very important there, where I can provide the patient a very healthy quality of life with or without diabetes, with or without kidney disease, with or without hypertension. You can really live a normal life, normal healthy life, even with diabetes, hypertension. And right now there are some drugs that has just come out. One of them, I don't want to advertise any drug, but these drugs are doing an amazing job of slowing the progression of kidney disease, reducing the incidence of heart attacks, heart failure. And the results were so impressive and done on thousands of people, that studies didn't even complete and they stopped it.
Okay.
And so what I'm saying, that all these things are really possible. You can really implement them, change them, and make it a simple step at a time, and just do it. You won't feel the difference. I see so many patients are able to do it. It's, you can eat the food now. Intermittent fasting is also has come. You know, it helps people.
It helps people.
Yeah. So basically, you have to know from your primary care doctor what are your goals. What should be your hemoglobin A1C? What should be your fasting blood sugar? What should be your blood pressure reading? What should be your serum creatinine? What is your GFR? What is your microalbumin? What is your cholesterol? It's a very important thing. Even with mild kidney disease, you have a very high risk of heart disease.
Okay.
Kidney patients don't die because on dialysis. They die from heart condition. So even if you're 30 and you're on dialysis, your risk for heart disease is somebody who's 80 or 90. So it's very important. So it's like all in one. To me, I see all in one. Same thing for diabetes.
Okay.
Same for high blood pressure. Same thing for kidney disease. Everything can be controlled. Watching your diet, monitoring, and just think that these are all silent diseases. You have to make effort to go to the doctor. More you go to the doctor, talk to them, more interested they'll be in you. So it's just one thing.
Just kind
that
of
I want to
regularly
say,
check up.
yeah,
And everything.
as much interest, patient shows as much interest in following their care with a doctor. Doctor become so much more interested in them too. So it's like both ways. If you are have an appointment and show up for 3 times, you think, okay, I don't have time then. You know, so it's.
So I understand 2 very important points on this conversation. The first one was that be aware of your health, right? So get checkups, you know, blood tests, urine tests, those tests, whatever the doctors prescribe, and you should know, like, you know, what's the silent diseases you could have, and you should, if it's caught at the right time, it's better because, you know, that way, you know. And then and you also said about that you said like regular doctor visits are important, because then you are taking ownership of your own health, you are interested, and the doctor is going to guide you on that, because they see that you are interested in your health, and then there'll be more timely intervention if that happens, right? So that is really nice, Rashmi. I'm really glad we talked about it, because a lot of people, as you said, are not even aware, because these issues.
And these are very simple things. You can really make those changes. They're not hard, because I see so many patients making it happen. But what the difference is, those who shows up, they're interested in their health, right? That's the message I'm getting. So I want to help them more.
Yeah.
Those who don't show up, or have to be
go for
reminded,
regular,
or they came in, okay, I didn't do my blood test. It's your health. So jitna, whatever efforts you put, results will be the same.
Result will be the same. Yeah. So take ownership of your health, and so that things are not delayed so much. Yeah. Thank you so much, Rashmi, for your time.
You're
It was
welcome.
great. Thank you. Thanks a lot. Yeah.
If you wanna talk about anything at all, then you know who to call. Just tell Sanjana. Tell Sanjana. Tell Sanjana. Tell Sanjana. Just tell Sanjana.